This medication, Doxepin Hcl Capsule, is used to treat mental and mood problems such as depression and anxiety. It can help improve mood and feelings of well-being, relieve anxiety and tension, help you sleep better, and increase your energy level. This medication belongs to a class of medications called tricyclic antidepressants. It works by affecting the balance of certain natural chemicals, neurotransmitters, in the brain. It is usually taken by mouth once daily at bedtime. The dosage is based on your medical condition and response to treatment. Be sure to take it at the same time each day. It may take a few weeks before you start to feel the full benefit of this medication. Before you start taking Doxepin, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually 1 to 3 times daily. If you take it only once a day, take it at bedtime to reduce daytime sleepiness. The dosage is based on your medical condition and response to treatment. To reduce your risk of side effects, your doctor may direct you to start this medication at a low dose and gradually increase your dose. Take this medication regularly at the same time each day to get the most benefit from it. Do not increase your dose or use this drug more often or for longer than prescribed. Keep taking this medication even if you feel well. Do not stop taking this medication without consulting your doctor. It may take up to 3 weeks before you feel the full effect. Report any new or worsening symptoms right away and tell your doctor if your condition lasts or gets worse. Some common side effects of Doxepin Hcl Capsule include drowsiness, dizziness, dry mouth, blurred vision, constipation, and trouble urinating. If these effects persist or worsen, it's important to notify your doctor or pharmacist. To reduce the risk of dizziness and lightheadedness, make sure to get up slowly when rising from a sitting or lying position. If you experience dry mouth, you can try sucking on sugarless hard candy or ice chips, chewing sugarless gum, drinking water, or using a saliva substitute. To prevent constipation, it's recommended to eat dietary fiber, drink enough water, and exercise. In some cases, a laxative may also be necessary, and it's best to consult your pharmacist to determine the right type for you. It's important to remember that this medication has been prescribed because the benefit to you is greater than the risk of side effects. While many people using this medication do not experience serious side effects, it's essential to contact your doctor if you notice any serious side effects such as heartburn, mental/mood changes, shaking, or severe stomach/abdominal pain. In rare cases, a serious allergic reaction to this drug may occur. If you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing, it's important to seek medical help immediately. This is not a complete list of possible side effects, so if you experience any other effects, it's important to contact your doctor or pharmacist for guidance. Antidepressant medications like Doxepin Hcl Capsule are used to treat depression and other mental or mood disorders. They can also help prevent suicidal thoughts and provide other important benefits. However, it's important to be aware that a small number of people, especially those younger than 25, who take antidepressants may experience worsening depression, other mental or mood symptoms, or suicidal thoughts. It's crucial to talk to your doctor about the risks and benefits of taking antidepressant medication, especially if you're younger than 25. Be sure to tell your doctor right away if you notice any worsening depression or other psychiatric conditions, unusual behavior changes, or other mental or mood changes. It's important to be especially watchful for these symptoms when starting a new antidepressant or when the dose is changed. Always follow your doctor's instructions for taking Doxepin Hcl Capsule and be sure to take it at the recommended time each day. Before taking Doxepin, make sure to tell your doctor or pharmacist if you have any allergies. Also, inform them of your medical history, especially if you have any heart problems, seizures, or if you are pregnant or breastfeeding. Doxepin may cause dizziness or drowsiness, so it's important to avoid activities that require alertness until you know how this medication affects you. Limit alcohol and marijuana use while taking Doxepin. It's important to limit your time in the sun and use sunscreen, as this medication may make you more sensitive to sunlight. If you have diabetes, monitor your blood sugar levels regularly and talk to your doctor about any necessary adjustments to your medication, exercise, or diet. If you are an older adult, be aware that you may be more sensitive to the side effects of this medication. If you are pregnant, discuss with your doctor the risks and benefits of using Doxepin. And if you are breastfeeding, it is not recommended to use this medication without consulting your doctor. When taking Doxepin HCl capsules, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. Some products that may interact with Doxepin HCl include thyroid supplements and certain medications used to treat high blood pressure. Avoid taking MAO inhibitors while using Doxepin HCl, as this can cause a serious and possibly fatal drug interaction. It's important to discuss any other medications you are taking with your doctor or pharmacist, as they may affect how Doxepin works in your body. Additionally, it's important to be cautious of other medications that may affect heart rhythm, as well as products that cause drowsiness, when taking Doxepin HCl. It's recommended to check the labels on all medications and consult with your pharmacist to ensure safe use. If you or someone else has taken too much Doxepin HCl capsule and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, or in Canada, contact a provincial poison control center. Symptoms of an overdose may include extreme drowsiness, hallucinations, fast or irregular heartbeat, fainting, shallow breathing, or seizures. It's important not to share this medication with others. Your doctor may also want to monitor your blood counts, blood pressure, EKG, and liver function while you are taking this medication. Be sure to keep all of your medical and lab appointments and consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take the next dose at your regular time. Don't take a double dose to make up for the missed one. When it comes to storing Doxepin HCl capsules, it's important to keep them at room temperature, away from light and moisture. Make sure not to store them in the bathroom, and always keep medications out of reach of children and pets. When it's time to get rid of unused or expired Doxepin HCl capsules, don't flush them down the toilet or pour them into a drain unless specifically instructed to do so. Instead, consult your pharmacist or local waste disposal company for the proper way to discard this product. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.